Morning, and thank you very much for joining us. I am Yori Folari. I will start off today on a medical note. The strike of the resident doctors, the National Association of Resident Doctors. There were indications, on Friday into Saturday, that all the matters had been resolved. The president had asked the Minister of Labor to bypass, as much sidestep was the word, sidestep as much as necessary, all the technicalities, and just get on with it so that we can get the doctors back to work. Among other interesting things, the federal government on Saturday morning agreed to pay 4.8 billion naira residency training funds to the National Association of Resident Doctors. Well, there was hope that this would sort of break the gridlock, but only for us to hear the following day that the National Association of Resident Doctors says things haven't been resolved, in the sense that whatever the agreements were on Friday had to still be presented to a larger body. So that's where we are now. As far as the federal government is concerned, it has agreed to clear the backlog of all their wages and all of that. And so I really don't know what else. Well, we'll be having on the program a couple of doctors, because we'll be combining this subject with also the whole issue of the coronavirus vaccines that that we're supposed to be getting. We have a number of doctors. We hope we'll be speaking to Dr. Jerry Isogun, who is the Secretary General, National Association of Resident Doctors. There have been one or two challenges. If we can, we'll be speaking with him. Dr. Madeli Boyo himself, a public health consultant, how this will likely affect, giving the jabs to those that are willing to take it. And also Dr. Japhet Olugbogi, all things being equal, that's the medical officer of health in the Apapa Igomo LCDA. He's also chair of the Committee on COVID-19 for the Nigerian Medical Association Lagos branch. But before all of that, I believe we can have a background package of the deal according to the federal government and all parties in the medical sector.
It's been 20 days now since activities across government hospitals nationwide have been paralyzed owing to the resumed strike by resident doctors. Patients have borne the brunt, with the lives of many who cannot afford private hospitals lost in the process. A series of meetings between resident doctors and the authorities have ended in deadlock. Now, the chickens have come home to roost as all parties meet again.
To build a nation where peace and justice reign.
Labour and Employment Minister Chris Ngige says this expanded meeting was at the behest of President Muhammadu Buhari. Chris Ngige says it is the president's desire that the strike be immediately called off. He also wants the doctors to put the nation first, a view echoed by the Minister of State for Health.
Mr. President takes this meeting very serious. Today is the son's wedding in Kano, but he gave me permission to bring ministers and all government officials. Some of them who will have been in Kano, they are here, so that we can do this discussion amicably.
Mine is to just once again appeal, come back to the negotiating table and sustain the engagement, the conversation. As far as I'm concerned, it's the only way to go.
The NMA president accuses government of not honoring agreements freely entered into, a position the minister disagrees with.
Enabling environment must be created. We cannot pretend that all is well. We're not even asking for too much. We're asking for the basic minimum. Make sure that the patients have adequate facilities to treat our patients.
The government dragged the resident doctors to the National Industrial Court for an injunction to restrain them. It also issued a no-work, no-pay directive. But the court adjourned hearing in the case to September 15. Among the doctors' demands are funding for residency training, withdrawal of the circular directing the removal of house officers from the scheme of service, and payment of over 5.5 billion naira in salary arrears, including arrears of consequential adjustment of minimum wage. After a series of meetings among all parties concerned, the expectation is that this meeting, which has now entered into a technical session, will produce good fruits in the interest of the suffering populace. Joke Edson, TVC News, Abuja.
Well, so there you are. That was the background until Friday, but that news seems to be a bit behind. Let me say good morning to Dr. Madeli Boyo, our public health consultant. Good morning, sir.
Hi, good morning, Yori.
Yeah, thank you for being able to join us as always. Now, I imagine, I wanted to find out from you, you being inside, you might not be, I don't know, you're certainly an NMA member. Maybe you could help clarify it, because according to the news, the latest news coming out is that a memorandum of action is expected to be signed by all the parties involved in the discussion. What news do you have?
Yes, what we have here, well, I'm not a resident doctor. We're elders.
I know.
I've been putting almost 40 years in the profession. What we are hearing is that there's mutual suspicion. Colleagues there they don't have the confidence that the government will not renege. They believe that they've gone through this route before, where government promises you all sorts so that you can resume, and after resuming, you see, the problem with this situation now is not with the doctors, it's with the government reneging. Each time they agree with some things with the doctors, they never ever fulfill them in total.
Yeah.
So doctors have now developed what you can call suspicion. They are very suspicious of the authorities, and they want to, as it were, get them not only to agree to do it, almost get them to swear an oath that they will do it.
Yeah,
so,
of course, I realize, Dr. Boyo, that you are far from being a resident doctor, but the NMA was also a part of the parties to the agreement, because it's like they brought together all the parties to the agreement, and government has actually agreed, according to the news on Saturday morning. That report that we just aired was as of Friday, late Friday, but as of Saturday morning, the news is that government has agreed to pay 4.8 billion naira training fund to that association within 7 days. Now, as you just explained, there still is a matter of maybe a suspicion coming from the doctors, because when we got in touch with Dr. Jerry Isokun, the Secretary General of NARD, he had said that, where did you get the idea that matters are about to be resolved? In any case, the agreement still has to be presented, as it were, to the larger body before any statement can be made. I thought it was a bit promising that all of them, NMA also being part of the people at the table with the minister, so had sort of agreed on the way forward.
Yes, the problem, like I still said, is the problem of can you trust the government? The current minister was once an NMA president, and so the Minister of Labor is also in the NMA, so you can imagine that. But yet, the doctors have gone through this road before, where promises are made and not kept. I can't blame the doctors for being very, very, very careful. Once bitten, twice shy. Once bitten by a snake, you run at the side of an earthworm. So they are like, oh, what's going on here? Now, let me tell you, the things the doctors are asking for go beyond money, go beyond approving 4.8 billion naira for training. They're asking for so many other things, including upgrading these hospitals and making them to work, including tools for service. They want systems in place that will work. So these young doctors are not asking just for salaries. They're asking for a package that will make the environment conducive. Listen, I can't even employ doctors in my hospital anymore.
Yeah.
They've all gone to London, gone to UK. We don't have any doctor that is post-NYC. They're all reading for exams abroad and leaving. They're simply saying that, look, if one of us stay here in the service, make the environment conducive. Let the CT scan work, let the MRI work, let there be lights, let there be drugs, let there be water. If you go to most hospitals, teaching hospitals, they are virtually dilapidated. I'm telling you this. So these doctors are not championing their own individual causes alone. They're asking that government should make it so good that our president will go abroad for treatment, our governors will go abroad for treatment. It will be possible to be treated in this country and be treated well. That's what they're asking.
Well, maybe if we can get hold of Dr. Jerry Sogun, he's going to speak for NARD. But as you've just said, it's not just about the payment of monies or salary issues for the doctors, because I'm quoting The Nation yesterday morning, I believe. Yeah, quoting The Nation yesterday morning, it was reporting that at the Friday renewed meeting, all the consolidated 12-point demand by NARD, the Medical and Dental Consultants Association of Nigeria, and other affiliates of NMA were resolved. That's a report as of Saturday morning. So that's what gave hope for optimism. But as I pointed out, after that, when we spoke with Dr. Jerry Sogun of NARD, he differed that, he doesn't know what, you know how it is, that his whole body was not behind it. But if the Medical and Dental Consultants Association was also there, and this whole process was brokered by the NMA, so we hear, can't we put some store on it?
Sorry to come in here. The problem is not what is on paper. The problem is implementation of what is on paper. So these young doctors, I've seen this written before. They now want what we call a guarantee that these things will be effected, like timeline, and that if this is not done within 2 weeks, this will happen. They are desperate. They have their backs to the wall.
Okay.
And so they are simply.
Even though government did state 7 days, the part that I stated that 4.8 billion naira had been ordered to be paid for their residency training, which you had explained was not the only issue, but even that was to be within 7 days, according to the meeting with the minister.
Yes, if they release 4.8 billion within 7 days for residency training, that does not explain about 11 other things there. So the government does cherry picking. They pick what they think they can do immediately, and then these boys go back to work and then come back on strike again.
Okay.
Can't we do something that will keep the doctors on their feet, satisfied? Imagine people not being paid for 7 months, 9 months. How does that 4.8 billion naira take care of people who have not been paid for 9 months? How does it take care of people working at the state general hospitals and have not been paid? How does it take care of people working in federal medical centers and have not been paid?
It probably doesn't. It probably doesn't, because it was specific. The 4.8 billion naira in the report stated specifically that it was to be paid to the training fund for NARD. But in the meantime, let me take Dr. Patrick, who has called in from Port Harcourt. Good morning, Dr. Patrick.
Good morning, Uncle Yeri. How are you?
Very well, sir. Thank you for calling in.
And our guest.
Yeah.
The problem of healthcare in Nigeria and education is interwoven, interconnected. Countries that want to move forward don't play with their education. They don't play with their health. It starts with the budget. How much is being budgeted for healthcare in Nigeria? Do the people up there believe even in healthcare? If they do, the president will stop traveling. The governors will start going to treat nose bleeding and wounds on their legs in America and the rest of them. People, individuals, are rehearsing and practicing this, and it's working. I don't want to mention them. In Port Harcourt here, an individual just took delivery of a cath lab. It's pricey. It's in billions in his hospital. Some doctors who plan to leave are reversing. Last time I spoke with him, what did he say? That he wants to reverse medical tourism. And it's working. He got an MRI, a cath lab, and a CT scan. To be precise, Civil Life Mission Hospital. And doctors are flooding back. They need tools. They need things to work. It's beyond getting money. Money doesn't treat patients. There are certain things private jets cannot help. Bingo the billions in the whole world. If you don't have MRI or CT scan to know the state of the brain, Naira and Kobo cannot treat the patients. The conducive environment, our hospitals are best like abattoirs. They are smelly. They are bad. This is why, if you have not traveled, I've lived in the U.S. and looked at what a hospital system looks like, you won't understand what people are talking about, because so many people here have not had that privilege. When you mention hospitals, our hospitals are not even keeping a corpse, not to talk of human beings. So it should go beyond this. There should be a legislation that will ban our political officers from traveling abroad. That's the first stage, because when you realize your life is in danger, you begin to look inwards. And thank God for this COVID. I keep saying thank God, because COVID showed us there could be a time when nobody could travel. The whole borders were locked up. They began to look in. Look at what happened to the chief of staff and the rest of them. He was treated in Lagos. If the borders were open, that man wouldn't have died. Who knows whether there's going to be another lockdown? It's hard time we begin to open up. Somebody experimented it in Port Harcourt. It worked, and it's working. And few other individuals. If you want the health system in Nigeria to work, an educational system, that's if you believe in it, put money in it. Educational system and health is what moves the nation. That's what is keeping America. That's what is keeping Germany and some of these developed world. As long as the health system here is not working, Nigeria is a moving disaster.
Okay.
Thank you very much.
I want to thank you very much, Dr. Patrick, calling in from Port Harcourt. Really, you've elaborated. This is exactly what Dr. Omadele Boyo was saying. But Dr. Boyo and indeed Dr. Patrick have both emphasized that it's a matter of can we depend on the authorities to do what they say they will do? I don't know. In a statement, looking again at the latest report, quoting again the Nation newspaper, in a statement issued on Saturday morning by the Deputy Director of Press and Public Relations in the Federal Ministry of Labor, Charles Akpan, he said that the President had directed him, that is the Minister of Labor, directed him to sidestep every technicality and recommence conciliation, especially in the background of the alternative dispute resolutions mechanisms. So it looks like the President is quite anxious that this matter should be dealt with, and if there are going to be technicalities, the protocol, civil service procedures, the President has said that go ahead and sidestep all those things with a view to resolving this matter once and for all. But in the meantime, Mr. George has called in. Good morning, Mr. George.
Good morning, Uncle Yori.
Thank you for calling in.
Greetings to Dr. Boyo.
Yeah.
Uncle Yori, I find it difficult to blame the doctor's insistence that action should be taken before any other thing. Because history has proven that promises have been made to them in the past and they were not fulfilled. So it's difficult to press on them now to go back to work, to, pending when another promise being made is implemented.
Yeah, but Mr. George, when the statement said specifically within 7 days, the 4.8 billion naira sum that I quoted that would be forwarded to the to NARD, even though, as Dr. Boyo has pointed out, that may be so, but it doesn't take care of so many other things. But even that is within 7 days, according to the statement. So, I mean, it's, I just said I'd add that in to show, do you think this shows a better seriousness of purpose by government?
You are right, Uncle Yori, but they were also giving some specific timeline before. And when they looked at it, it wasn't implemented. There's this element of trust issue on ground now. The trust is not there.
I see.
This is the thinking of the minister.
Yeah.
Why did they abandon discussions instead of resolving issues? He went to industrial court. Is that the way?
Yeah.
For me,
well, the president has now said sidestep all that stuff, explore alternative dispute resolution mechanisms.
Okay, well, the president said that. I will want now that the president appears to be more interested in the matter, I would suggest that the president should take the matter of the Minister of Labor and allow the Secretary to the government to handle this matter directly. I believe the doctors will listen to the Secretary to the government if he's addressing them directly and promising them that this is what they want and that this is what the government wants to do. Because
I get
between the doctors and the minister, there appears to be loss of trust.
Yes.
And then for things to work, the president should elevate the negotiating table. That's my suggestion.
Thank you very much for calling in. So, Dr. Boyo, well, the agreement was initially seen as possibly laying the foundation, speaking to Dr. Boyo now, possibly laying the foundation for a sort of a peaceful resolution and a timely resolution of all of this. So, Dr. Boyo, if you're still with us, in the meantime, I hope not, but if this action by doctors were to continue, I wanted you to sort of sketch for us the effect that it might have on, you know, here we are, the COVID-19 vaccination exercise is on, we're about to begin the, what, is it the third phase or whatever? How it would impact it, especially as people are saying that the virus is more virulent and people are coming down and there's such a short gap between hearing that you've been infected and indeed, God forbid, you know, a fatality. How do you think all of this is going to impact that particular public health exercise if the matter is not resolved in a timely manner?
Yes, maybe I should first of all draw your attention back to the last thing that was asked. In December 31st, 1983, when the then Major General Buhari came to power with the Diagbon, the one thing he said was that our hospital will now make consulting clinics. And that was why he took power in December 31st, 1983. Now, he came into power in 2015. For 5 years, now 6 years, we are still talking about getting the hospitals back on their feet. This is too long and too much. So let's face it, the doctor have a reason to just get angry if after 6 years as a president, he just has 2 years to go, 2023. You can't fix any teaching hospital in Nigeria. You can't fix any general hospital. We can't get anything done since 1983. That's by the way. So talking about COVID-19, what we have on the ground now is a disaster. People are falling ill. I mean, it's not like even the first or second wave. People are falling ill now. The big hospitals, the doctors are not working, so people are left to their own devices. And because this COVID resembles malaria in many ways, in that you just have temperature, you are weak, you have a banging headache, you can't even move yourself, people are just going to self-medication and going to pharmacies and drug outlets to pick up drugs. Now, the private hospital in Lagos, unlike other parts of the town, are quite many. They can, about 60% of people in Lagos go to private hospitals. But then when you now have something like COVID, you are referred to an isolation center and then the teaching hospitals. Now, these places cannot cope again because they don't have the resident doctors and junior doctors that will receive you and do the work. You only have the big bosses, the consultants on duty. So what we're having now is a catastrophe waiting to happen. No. For the last 3 weeks, since the strike started, we all knew we're in COVID period. You don't allow such things to go on. Sort it out as much as possible. Placate them, get them back to work. This is the wrong time to go on strike, and this is the wrong time to provoke them. And they waited to get the government arm twisted. The very difficult time for the government. But it became worse when they saw that the president could jet out for treatment. And then the poor are dying in this country. Come on, who does that? So I think the president should be shocked that he did that and should apologize to the country. Then to get these health systems to work. People are dying. There's not an isolation center close to us now within my local government. That's to tell you how bad it is. We're now in the third wave, and this third wave is killing unlike the first and the second wave. So I'm appealing.
I beg your pardon, doctor. Yes. Let me bring in Dr. Japhet Olugbogi. He's the chair of the Committee on COVID-19 for NMA Lagos branch. He's also the medical officer of health for the Apapa Igomo LCDA. Good morning to you, Dr. Olugbogi. I think there's a technical issue, but Emmanuel is on the phone. Good morning, Emmanuel.
Good morning, Yeri. How are you?
Very well, thank you. Thank you for calling in.
Honestly, I listened to one of your callers and this gentleman here. This is a topic that is very sensitive and sometimes makes you feel very provoked. You know, actually recently traveled down from the United States of America, where my wife went to have a baby. I just want to let you know that improving healthcare here is not a rocket science. Individuals like that first caller said are doing it. Why can't government? Okay, my baby had jaundice. And they were telling me, I called the United States, asked them, what am I going to do? The doctor said you need a blue light or something. And somebody recommended a hospital guy called in Port Harcourt. I went there. Exactly what I saw in the United States is what these guys are bringing in. And my mind is this. If individuals could do this, why not government ask questions like that gentleman speaking on television now? Or this guy in Port Harcourt, the Save a Life guy he mentioned.
That's the doctor
These guys
called
are
him for
doing
Port Harcourt.
well. Why not? Yes, the Save a Life hospital guy he talked about. These guys are transforming healthcare, bringing equipment that are used in the U.S. All my kids had them in the U.S. I saw better things there than what I use in Houston and Atlanta. Why can't government sit down with these guys and say, can we make these things happen? How did you guys do this? Okay, you used maybe 900 million for the cath lab. We give you 5 billion. Replicate it in the zones. Put one in the north, put one in the south, put one in the west. This is not rocket science.
Okay.
Just like schools.
Okay.
You know, these expatriates are ready to come in here and help.
Well, thank you very much for calling in. I believe we can speak with Dr. Japhet Olugboghi now. Good morning, doctor.
Yes, good morning.
Okay, then. Thank you very much for joining us. Now, this truce, what we are calling a truce because it was reported as such, that is to say that, all the parties, it was actually brokered by the NMA led by Professor Innocent Uja. And that sort of gave one confidence because all doctors seem to be, on the same page regarding this whole matter. Now, we've been hearing about trust. Trust has been sorely tested by government as it relates to whatever agreements they come up with the doctors. But in this case, is there any difference, especially as the whole affair was brokered by the NMA headed up by Dr. Uja, Professor Uja, I beg your pardon?
No, if I understand correctly what you are asking, I don't think there's any difference because all the parties were there during the agreement and the memorandum of understanding signing. And all the points that were causing rifts were trashed out one after the other. And then while they were being trashed out, each and every member of the party who represented consented to the agreement at the end of the day after each point had been trashed. And then I think the only issue now is signing of the final signing of the memorandum of understanding, which the National Association of Resident Doctors refused to sign for a particular reason. And then I think that is the only cog in the wheel right now.
Okay, because as you are just saying, the report did also say that all the consolidated 12-point demand by the Association of Resident Doctors, the Medical and Dental Consultants Association of Nigeria, and other affiliates of NMA were resolved. So they were resolved, but maybe I'll just take this new direction from you that, yep, it's the NARD for their own reason have not agreed to sign yet. But as I was saying, when we got in touch with Dr. Isogun, I hope maybe we can still get him on, but he had warned us that there were network issues where he was. I don't know. He said that the matter still had to be taken to the larger body for them to peruse it and then give the say-so to sign. So that's where we are now, Dr. Olugboghi. What you're saying is that, yes, all the points brought up by all the affiliates of NMA have been addressed and ticked off, but it just remains the signing, right?
Let me add something
Sure.
which I intentionally held back. Actually, when the agreements were trashed out, and the memorandum of understanding, which comprised parties from members from the two parties or the three parties present. The memorandum of understanding was drafted, and the members from the federal government signed. Also, the representatives of the NMA also signed, but the NARD representatives refused to sign on the ground that the federal government should insert a clause that would protect members of the National Association of Resident Doctors who did join the strike or did not join the strike from the federal government not paying them their salaries. Because the federal government had threatened earlier on that they would institute a no work, no pay policy.
Okay.
And so I think the Minister of Labor and Employment did say that they had already instituted that policy. So the NARD wanted the government to insert that clause into the Memorandum of Understanding so that her members who joined the strike or who probably did not join the strike will not be victimized in any way at all.
Okay.
So I think that is where this put is.
I see. Well, thank you for that clarification, Dr. Japhet Olugboghi, and to Dr. Amadili Boyo also. We'll just take a quick break, but stay with us, please, both doctors. Stay with us if you can, because we'll be right back. Okay, welcome back. We're looking at what we think of as an initiative by a government, even at the insistence of President Muhammadu Buhari, to sort of re-engage with the talks. And on Saturday morning, it was reported that the federal government had agreed to forward 4.8 billion naira residency training fund to the National Association of Resident Doctors within 7 days. And apart from that, it is thought that all the consolidated points, all those have been resolved, as we just heard from Dr. Japhet Olugboghi. But there are still some outstanding issues. For instance, Dr. Olugboghi pointed out that that whole policy of government, no work, no pay, in the midst of the strike, they just want the government to adjust that area so that no doctor will be sanctioned for taking part in what they must see as a righteous kind of a strike. So here we are. There's also the point that government had said that it had, through the Federal Ministry of Health, forwarded a list of 38 hospitals to the Budget Office for inclusion in the service-wide vote. Reverend Dominic, good morning, sir. Reverend Dominic?
Can you hear me?
Reverend Dominic, can you hear me? Okay. Dr. Boyo, are you still
Hello,
with us?
can you hear me? I'm still here.
Okay, now I can hear you, Reverend. Go ahead, please.
Okay, good morning.
Good morning, Reverend.
Can we make this matter so simple and make it in first phase and second phase? Now, if to treat Nigerians is a problem, and I heard, can you hear me?
Yes, we can hear you.
And I heard that Mr. President said to his, I don't know who he said to, that he don't want to leave office as a failure. Can't he make this in this simple way? Make Asrock the best hospital in Nigeria for himself, for his elites, for political elites, for the big men of Nigeria, and leave us alone this side. At least we can be proud that at least we have a hospital that our elites can attend to in Nigeria.
Okay.
When Nelson Mandela was sick, he was treated in South Africa. It didn't move out. And I don't think that hospital in South Africa is for free for all. It's for elites. At least we have solved that matter. And leave us this side. And maybe we can start protesting, maybe years again, to get a hospital some of us here can attend. But let this shame go out of us. How would Mr. President, in this 21st century, still go to London for common treatment?
Okay. Well, we've just been joined by Dr. Jerry Isogun, Secretary General, National Association of Resident Doctors, NARD, Reverend. So excuse me, please, while I quickly touch base with him. Good morning, Dr. Isogun.
Yeah, good morning.
Thank you very much. Thank you very much for joining us. We had heard that network conditions might be a bit difficult where you were, but we're happy to have you. Now, what is the position really for why the National Association of Resident Doctors has declined so far to sign that memorandum of understanding that all parties, were involved with?
Please, can you come again? I didn't get you.
Why hasn't NARD deemed it fit to sign the MOU that they came up with on Friday?
Yeah, thank you very much. You agree with me that before that meeting was called, where NMA was invited and we were asked to be in attendance. And we've signed several memoranda. And the mandate for this strike, the reason we're on this strike, all Nigerians need to know, is because those documents you have signed have not been honored by government. And you have come again with another one. I think you agree with me that that was not the way to go. And
okay, but this time they put a 7-day, oh dear, they put a 7-day limit. They say that the 4.8 billion towards the training, which we have been told will sort everything out, is within 7 days. Is that not good enough?
Yeah, let me remind you, the MOA, which was Memorandum of Action, had timelines. And according to the minister at that time, the MOA was the highest. He said that if you have MOU, it's an understanding. But once you have MOA is an action plan that has failed. I'm happy today that we have been vindicated. When we were shouting that this government was not sincere, you know, people thought we were lying. Today, we thank God for His grace. Today, we'll be vindicated because we are signing another document with timeline. Now, assuming without, you know, considering that we should have signed that document, as if just giving us promises at this very point, you know, was not bad enough, you are still putting in clauses that show that you are not ready for resolution yet. You know, don't forget that if not for the wisdom of the court that gave this, you know, window for alternative resolution that we are using now, you have already taken us to court. So this is a clear sign of, you know, a government that is not sincere with its people, with its citizens. You know, it's a clear sign of insincerity. Now we are saying that the mandate for this strike, because of the previous, you know, failure on the part of government in fulfilling promises, our members said that they want actions. Now, because we are responsible association and we want resolution to this whole impact, so that our patients will, you know, will not continue to suffer, we have come to meet with you, you know, to see how we can resolve these issues. Don't forget also that we the leaders, don't have the mandate. The mandate is with our National Executive Council. We were ready to call them and explain to them what we, you know, at the point we are, you know, as if, you know, that is not enough, that we are still going to go to them with promises. You are putting clauses that you are still going to continue with the, you know, the old way of you trying to punish those that are asking for their rights.
Okay.
No, even if you are sincere, you want to resolve this issue, I think the first thing to do is to, you know, first of all, tell us that, okay, now that we are here, you are withdrawing that part of, you know, the court case, and you are not going to punish anybody.
Okay.
You are putting a vague statement in the document that nobody will be victimized. And we are telling you that statement to us, we are not satisfied.
Okay.
If you are sincere, you will quickly give it to us the way we understand it. The government in democracy should be the government of the people, for the people. We are the people here. We are telling you that we are not comfortable with that clause.
Okay, but
if you are sincere and you want to resolve this,
Dr. Shogun,
Dr. Shogun, what we want to our members, enough for us to convince our members to suspend the strike.
Okay, but Dr. Shogun, I wanted to ask you.
We are still going to go to our members with promises, even though you said 7 days. You have not done it. Those that you have not paid are still the ones that are still going to go and appeal to tell them the government said 7 days. At this time, please, let us believe them. Because it's a difficult position.
Okay, I can appreciate what you say, but I wanted to ask you if it doesn't count for something that this re-engagement, so to speak, with a bit more concrete, is that the instance of the president who has actually asked the Labor Ministry to sidestep, you know, all the technicalities and perhaps protocols and difficulties, and explore alternative, resolution mechanisms as well. Well, as I say, it coming from the president this time, it doesn't make very much of a difference that, well, maybe things have changed now that the president is willing to come into it and even say to them, bypass some of those protocols because we must resolve this matter. Dr. Isogun.
Yes, in fact, that is why we are even discussing the MOU in the first place, because we feel that all we've been waiting for is executive power. We feel that we have it, and if we have such, moving forward, you should first of all withdraw the court case, which was what everybody have agreed that the wrong way to go. How can you take those that are agitating for their right to court? So if you have, if you are expecting the president, I think that this person we are talking about should not be an issue. Should not be an issue. So Nigerians people know, because you are saying one thing at one hand and you are doing another.
Okay.
Another hand.
So is it that NARD, for instance, feels helpless to do anything else, even though there is this pandemic very much out there, and we are about to start the vaccination exercise for, especially in these times of the Delta variant? I'm sure this must be agonizing to the doctors as well. What impact do you expect that this will have on that exercise of immunizing people, vaccinating people?
No, we have said it from the beginning. We are very empathic. We understand the peculiarity of this time we are in, and that is why we are here trying to resolve this issue. But you agree with me that if you are hungry, you cannot even go to work. It will complicate issues. It will cause more harm than good. So the government should, first of all, address the foundation, address the issues, make the doctors comfortable to be able to go to work. Don't forget also that among our agitation is getting, in service benefit for the 19 of our members that we lost. So what confidence do we have that working for this government, if anything happens to you have any form of benefit that your next of kin we use to cushion the effect.
Okay. Let me switch to Dr. Olubogi, if you're still with us. Now, the ongoing exercise to vaccinate as many people as want to get the jab, how is it going to be affected by this, or how will your association, because you're the medical officer of health for the Apapa Igomo LCDA, apart from being chair of the COVID-19 on COVID-19 for the NMA, the Lagos branch. How is this going to impact that particular exercise, Dr. Japhet Olubogi?
It's not only a question of how is it going to impact. Any group of doctors striking for one reason or the other would always affect the healthcare sector in a negative way. It will always affect the health sector in a negative way because we are talking about a dearth of doctors in Nigeria, and some of them are on strike, and the government is not, expediting action on it. So this will, slow down the vaccination exercise. You will recall that some of these resident doctors are public health physicians who are also involved in this exercise in one way or the other. Some of them are to pick up cases from the different teaching hospitals and the federal medical centers, cases that they would normally refer for testing. So there is no way the strike action will not impact. There are people who need medical care. There are people who test positive who need medical care at the various isolation centers, at the various teaching hospitals. These are people who ought to be taking care of them naturally. So the onus lies on government to quickly resolve this impasse so that every hands that we have can return to their desk and do the needful.
Okay, before I come to
leaving Nigeria in their droves. So we can't have the remaining doctors in Nigeria. We can't have any group of them or any number of them being on strike at all at any point in time.
Okay, before I come back to Dr. Omadele Boyo, I wanted to come back to you, Dr. Isogun. Did I understand you well enough to say that what the main thing that remains is that let government withdraw that policy of no work, no pay, and as a result, proceed to sanction doctors that did, participate in the strike. If that is addressed, if government were to say today, okay, we concede that as well, would that sort the matter out in terms of signing and then begin to address whatever other issues are necessary? Did I understand you correctly?
What I said, let me repeat myself. I said at the meeting, like you may have known, nothing has been done. What we have agreed on, like you said, that will be done within 7 days, are still the promises. Even though you have said 7 days this time, you have not done anything. Okay. Assuming without considering that we should have signed that document, assuming we wanted to sign, you are still bringing a clause. You are still, effecting your threat or the issue that you are taking to court at this time. You are saying that you are punishing those that have gone on strike to agitate for their right. The right that you have not even been able to, the agitation that you have not been able to resolve. You are still promising them. You are begging them to go back to work. You are still putting there that you will punish them. Where is that done? So what we are saying is that at that instance, if the government is sincere, that clause that we are talking about shouldn't have been there. Then the ball will not be in our court to go to our members and plead with our members and say to them, please let us, because of our patience, listen to the government and give them the benefit of the doubt.
Okay, I think it's clear now.
It has been so clearly that this government wasn't sincere from our initial.
Okay, your position is clear, Dr. Isogun. Dr. Amadi Liboyo, as a public health consultant and expert, what does this do to that space, public health, especially in the light of the Delta variant that is ravishing, if we're to believe reports? What is this going to do? What impact is it going to have?
Ravaging. Because right now, we have nurses. I mean, the Lagos State government has started the new vaccines, J&J, Johnson & Johnson, and will soon give the AstraZeneca. So, and we know it's nurses that affect these things. So people like my colleague, Dalubugi, and others, are the apex of the coordination, the strategies, and they have to make sure that things get from Abuja to Lagos, from Lagos to various local government health centers and these things. So doctors have a role to play. Then when people fall ill and they are taken to the isolation centers, you don't expect people who have not been paid their salaries for the next 9 months to be there. The resident doctors are the ones who really have the hands-on capacity to do this work. So once they're not around, the isolation centers are just mere offices and rooms. The nurses will try their best. But management of COVID is beyond nursing care. It needs specialist attention, we need ventilators, we need anesthetists, we need all kinds of people on duty. Now, if the government doesn't handle this thing well, it will be a catastrophe on an already existing catastrophe. Like I said before, the hospitals are mere consulting clinics as professed by Buhari in 1983. They're still the same till today. These young people, sorry to call them young, most of them are in their 30s and early 40s, but these doctors are simply saying, give us the tools. Yeah. People give us the tools to work. So if people are sick and they're referred from private hospitals, from other hospitals to these isolation centers, they need to meet doctors there that will take care of them. Mm-hmm. If the consultants can't work alone, they need a doctor as a team to carry out this job. And managing...
Dr. Boyo, I'm sorry to interrupt you, but I wanted to get your comment very briefly, if you will, on the incidents we're hearing now of people who have been fully vaccinated coming down with a COVID infection, even though they've received both jabs. That you've alerted before now is not totally unexpected, right?
Yeah, it's not totally unexpected. But you see, what we have on hand now is that most of these people we're talking about must have comorbidities. When we see people coming down and we look at it, some of them have other issues. And having COVID-19 vaccination does not stop you from masking, doesn't stop you from keeping a safe distance, doesn't stop you from hand washing. But once our people got the COVID-19, they became invincible. They opened the doors, parties, mega spreaders, funerals, everything took off. And we have and we are in most of these things, like funerals are attended by the elderly. You don't see young people going for funerals, you see more of elderly people. And most of our elderly people have diabetes, hypertension, underlying illnesses. Now, the vaccine is to prevent. It doesn't stop the COVID.
Okay, Dr. Boyo, we're going to have to leave it there. Thank you very, very much. And also, we extend our appreciation to the chair, the Secretary General, National Association of Resident Doctors, Dr. Jerry Isogun. Thank you for joining us and clarifying those issues and pointing out what indeed the remaining issues still are. And also to Dr. Japhet Olugbogi, Medical Officer of Health for Papa Igomo LCDA and Chair of the NMA Committee on COVID-19. And of course, to Dr. Omadele Boyo. Thank you very much, doctors, for joining us this morning to help us understand these issues. All right, then. So that's our program today. As you've heard, it's still very much out there. Do whatever you can, to keep the COVID-19 protocols for safety. Indeed, probably the best is go ahead and consider getting the jab itself. That's our program today. Please join us tomorrow for a fresh edition. I'm Yori Folarin. Bye-bye for now.